A Republican bill that bans DEI initiatives and targets LGBTQ+ students in public schools and gives parents more power to file complaints against teachers resulted in unintended consequences. Some school nurses wouldn't give bandages or temperature checks to students for fear of being accused of violating the new law. Senate Bill 12, which conservative supporters say provides a parental Bill of Rights, went into effect on September 1st. It requires schools to obtain parental consent before offering healthcare services to students. Critics called the legislation unconstitutional, and the ACLU sued to block it in August. At the start of the school year, the new law triggered confusion among campus nurses and staff who worried that they could face punishment for routine acts of care. Granbury ISD, which is located southwest of Fort Worth, for example, announced it wouldn't assess or treat a student except in life-threatening emergencies. In response, lawmakers called on the Texas Education Agency to provide clear and consistent guidance so schools can avoid any further confusion. The TEA recently released a new set of guidelines that aim to make a clear distinction between healthcare services and health-related services. Healthcare services, which require parental consent before schools can provide them, involve medical treatment, medical procedures, dispensing medication, or administering a psychological or psychiatric test or treatment, according to a memo from the agency. Health-related services are short-term and non-invasive activities that promote students' well-being, such as bandages and ice packs for cuts and bruises, counseling, or mental and physical health screenings. Under the TEA guidelines, schools should assume they have consent to provide such services unless a parent opts their children out of them. The agency also notified districts that it expects them to provide parents with consent forms detailing the types of services students can receive from their schools, and to give families the option to opt in or out of each one.